When we think about Zika, right now we think about the Olympics and global spread, but we also have to remember that we're in a global community and Zika could be here in the United States in very short order. In fact, there are hundreds of cases, actually a little over 100 cases, that have been imported within the United States. The good news is that we have no sustained transmission of Zika within the United States. In other words, people coming in from other countries with Zika have been diagnosed, but there's been no sustained mosquito-borne transmission of Zika. Doesn't mean we can't have it. So how do we prevent that? Some of the common strategies that pharmacists should recommend to people in any communities, but especially in the south and southeastern part of the United States, which is where the Aedes mosquito, that mosquito that transmits Zika primarily, is common and does occur. So what can people do? They can make sure that there's no standing water. So how do you do that? Empty tin cans, empty vacant little ponds and streams that have become stagnant. So they can try to work on the environmental control side. Because this is a day-biting mosquito, you can recommend that patients, although they don't really think about using insect repellent at home, but they should. So if you've ever lived in the South, I lived in Louisiana growing up, they have lots of mosquitoes, and we used insect repellent. So making sure that they do use it consistently now, thinking about their risk for this disease. Right? Within the United States, do we need to say anything differently about pregnant women? The answer is no. Right? As a travel recommendation, that's where the CDC gets involved. From a domestic recommendation, they would treat pregnancy or children or others with the same level of prevention strategy, which is mosquito cleanup, using insect repellents that are appropriate for that population when mosquitoes are present. But other than the environmental and personal protection strategies, all we can do is hope that Zika burns itself out throughout the globe, which, if history has taught us anything, these types of viral infections do that eventually, and make sure that we have a strong public health infrastructure. The CDC is trying to garner more support to be able to put more mosquito control measures in place. These things that public health can really do, from mosquito abatement and sterile males and all different types of strategies that they use to knock down the mosquito population, because ultimately that is the main thing we can do, is to knock down the mosquito population for protection domestically.